Yeah,
Right,
syndesmosis.
with a syndesmosis injury or a high ankle sprain, the taping has to change a little bit. You still do the initial ankle taping to stabilise the ankle. You add on an extra bit to compress the tibia and the fibula together. Now Kristen's going to show us what we're doing. The initial part she's putting on is a fixable under wrap. Now this is just to protect the skin, because when the tape comes over, it crosses over, it can cut into the skin here and at the back. So it's nice to put on a little bit of that underneath. That's why those two patches are there. She's going to start with a normal sports taping for a lateral ankle sprain. Now we're going to use this without a under wrap, just for sense of time. So she's going to use the rigid tape straight on the skin. Normally we'd put on a under wrap or a Cred.MDT depending on what the patient needs to stop the skin irritation, especially if this is going to be on for a long period of time. So with the normal ankle taping, she's going to start with her anchor. She's going to do a stirrup going from medial around to lateral. So she's covering both sides. She's going to do 2 or 3 of those. Then she's going to do some ankle locks. So we're going to have a look at that. These ones are important for general stability, but like I said, this is sort of the base or the underneath stuff that you do before you do the syndesmosis, which is a bit of a specific taping. So we've got 2 stirrups there. Then what she's going to do, everyone's a little bit different with, between physios of what we do. Kristen she's got a big sports background. She likes doing an extra one. You'll see that there where it's covering a little bit more onto the tibia and going on an angle, and then this side is coming up on there. So it's a bit like a 3rd layer of that. Once she's done those stirrups, she does an ankle lock. So starting from lateral, coming medially. Now it's important to get your angles right with this, because you're going to come across the heel on the medial side on a diagonal like that, which gives you the correct angle coming around the other way when she comes up the top. All right, so she's going to do a few of those, both medial and lateral. And again, this is just forming that base layer. She comes exactly, it's almost like the opposite, right? Comes around. This is where you'll notice that this white tape is crucial, because she's coming across that. Now, if she doesn't have that nice little bit there, she's going to, that tape will cut into the skin. That can cause some discomfort. So important that we make sure that that is there. Again, second lateral one coming around. And there you go. So there's our base stuff, right?